We have been told that men and women are the same. Biologically, however, we're very different, and in many cases, women have it worse. Women have unique problems that us men don't experience, and more women have been having these problems in the past few decades. Statistically, anxiety, depression, insomnia, painful periods, PMS, PMDD, Hashimoto's, endometriosis, polycystic ovarian syndrome, and many others are present in more and more women without any clear explanation why. Those trends are quite alarming, but many doctors prefer to treat the symptoms without thinking about the underlying causes. Women's health is often neglected and pain is seen as something normal. But what if there are concrete reasons for all of these conditions that have stayed hidden from us this whole time? Let's find out. Men run on testosterone, while women run on estrogen and progesterone. In the modern world we live in, we are surrounded by estrogen. At first, this sounds great for women. More estrogen means better health, right? But what if women's biology isn't as simple as that? What if too much estrogen isn't necessarily a good thing and it can also be a bad thing? Let's see what estrogen does to the body. The first evidence that shows us the effect of estrogen on women is puberty. The average onset of puberty for girls has been steadily going down each year for the last few decades. 100 years ago, girls would enter puberty around age 14 or even 15, while most girls today have already started puberty by age 12. Puberty is triggered by a variety of hormones including estrogen. The more estrogen a girl has early on, the earlier she enters puberty. The data proves that more and more girls have higher or even abnormal levels of estrogen for their age. So, what exactly are estrogen and progesterone? Estrogen is a group of steroid hormones that are responsible for the development of the female reproductive system, fertility, menstruation, secondary sexual characteristics, and others. Progesterone is a steroid hormone which prepares and supports pregnancy, regulates the menstrual cycle, and balances the effect of estrogen. Now, what does too much estrogen even mean? Estrogen peaks before ovulation and during pregnancy, so a lot of estrogen is actually necessary sometimes. What causes problems is too much estrogen compared to progesterone. Estrogen and progesterone have a special relationship because estrogen can cause a lot of trouble on its own. And that's why progesterone is always there to balance it, to balance the effect on the reproductive system and on the nervous system. Remember, too much estrogen without enough progesterone means problems. The biggest cause of this hormonal imbalance are foreign estrogens or xenoestrogens that come from our environment, the food that we eat, and the products that we use. All the microplastics in bottles, clothes, and basically everywhere, all the heavy metals in the water supply and our food, all the additives in our diet such as the added growth hormone in chicken, most of the commercial makeup, skincare, and perfumes. All of these things flood women's bodies with excessive estrogen, which builds up over time. The second biggest cause is a poor diet. Being overweight or obese is detrimental to everyone's health, and it surely causes an imbalance between estrogen and progesterone. Some medications have also shown to lead to estrogen dominance. Estrogen imbalance manifests itself in different ways in different women. We know that estrogen affects the brain. Too much estrogen without enough progesterone can lead to more anxiety, depression, irritability, and insomnia. We know that estrogen plays a key role in the follicular phase of the menstrual cycle. If there's too much estrogen, the lining of the endometrium can become too thick, which then causes painful menstruation, called dysmenorrhea. Too much estrogen can make PMS and PMDD symptoms worse. It makes the perimenopausal period worse. Bones, the cardiovascular system, metabolic tissues, endocrine tissues all have estrogen receptors, which means that the estrogen imbalance effect can be seen at many locations throughout the body. Studies show a direct link between ovarian cancer, breast cancer, polycystic ovarian syndrome, endometriosis, Hashimoto's, and endocrine imbalance, and this is just the tip of the iceberg. Biology shows us that women's bodies are quite sensitive to hormonal imbalances. Unfortunately, modern medicine often fails to recognize those key details, which results in poor management of many of the common conditions. Don't wait for big pharma to look after your well-being. Take care of your health and hormones today, and you'll see the difference. Your health is your responsibility.